Hello, everybody, and welcome back to Section 7 of Stop Fighting Cancer. And we're going to dig into some other issues with cancer. So, I have said for many years that I believe that cancer has an autoimmune component to it. So, I want to explain that a little bit today. So, what is an autoimmune disease? Now, by definition, if you Google search autoimmune disease, you're going to see when your body is attacking self tissue. Well, that's what we really want to take place with cancer. We want it to kill these cells that are gone rogue and that are in a rapid replication state and are dying. We want them to kill that. Well, that's one issue that we have with cancer is that your immune system isn't initially attracted to your own cells that are in rapid replication because they are your own cells. So how does autoimmune play with that? So first of all, with autoimmune issues, you need to understand a little bit about what the immune system is. Your immune system contains numerous different chemicals, different chemokines and cytokines and white blood cells and macrophages and just a bunch of different slurry of chemicals that are involved in two major processes. The first process is lumped together in what's called a Th1 response. And the second process is a Th2 response. So we're going to simplify it greatly here. But for the most part, your Th1 response are typically the response of the killer cells. So they are the Marine Corps with machine guns that are going to kill pathogens that enter the body. That's what we want to take place with cancer. We want an increase in the Th1 cells. So anytime that you would take an immune stimulant, quote unquote, like garlic or vitamin C or echinacea or astragalus or something like that, that is a known immune stimulant, it's really stimulating that Th1 side. It's arming the Marine Corps with machine guns so that they can go kill the pathogens. Well, when a person has an autoimmune issue that is diagnosed as an autoimmune disease, let's say they have MS or rheumatoid arthritis or Raynaud's or rosacea or something like that, it is typically a Th1 dominant disorder if it's aggressive, meaning that they have more killer cells out there that are armed that are then killing self tissue for reasons we won't get into in this little piece. And it's destroying that person's body. So they're destroying neurons and they're having, brain issues. They're destroying joint capsules. So they're having joint issues. That's typically a Th1 dominant autoimmune issue. So understand that an autoimmune disease leaves a person either Th1 dominant and they get all these horrible symptoms, or it could leave them Th2 dominant. The Th2 side of the immune system is mainly responsible for making antibodies so that the Th1 side can go find out what it's trying to kill and kill it better. So the Th2 side is less destructive. It leaves a person with more of a chronic inflammatory process than a sudden acute inflammatory process. It doesn't do a ton of killing, it just leaves with these inflammatory markers because of the Th2 cytokines. So with cancer, we really want to stimulate a Th1 response because a Th1 response will help kill cancer cells. Now, we're going to talk about that in later sections of this book and how to do that and what to take so that you can stimulate a Th1 response. However, in this little piece, we talk about that cancer, typically at least at the site of the cancer, the person is in a Th2 dominance. Now, that is important because that's what can help the cancer grow. We don't want to be in a Th2 dominance. Matter of fact, growing cancer cells, there's much research on this now, actually stimulate a Th2 response at the site of the cancer. So the cancer cells themselves are creating cytokines that are decreasing your own immune system's ability to kill it. So when I say all cancer is autoimmune, I mean that it has an autoimmune component. The person could have had an autoimmune disease, Th2 dominant, for decades and not known about it, and that's what helped bring the person to be more susceptible to that cancer growing, because their immune system wasn't able to keep it at bay. I mean, their Th1 system wasn't able to keep it at bay. But also at the site of the cancer, even if they didn't have this long-standing autoimmune issue that was Th2 dominant, they become Th2 dominant at the site of the cancer. And we really do want to balance that. There's some things that we want to do to balance that. So normally a person should have a balanced Th1, Th2 side, and when you're exposed to a pathogen, your Th1 side increases to kill that pathogen. If it wasn't able to kill that pathogen after 2, 3, 4, 5 days, then the Th2 side fires for the purpose of making antibodies to that pathogen, so that when that suppresses and the Th1 side fires again, it's able to kill that pathogen. That's a normal immune response. But with cancer, you could get stuck in that Th2 excess. You're stuck in a Th2 dominance at that site of the cancer. So your immune system isn't able to keep the cancer at bay, and it's growing. So we want to bring that into balance and to actually fire a little Th1 imbalance, so you're hyper Th1. That's what we really want with a cancer patient. We want them to have that immune ability. We want to arm the Marine Corps with machine guns so that they can help kill the cancer. It's a very important piece when dealing with a cancer patient. So I spoke really fast. I know that. Watch this video again if this is all new to you, and read this section. I think it'll be beneficial. We'll get into, as we get into my favorite things here, we're going to get into things that many of them stimulate a Th1 response. That's why they work with cancer. And that's why the danger of chemotherapy is that it stimulates a Th2 response, because chemotherapy is going to shut down your killer cells. So it just drops your whole immune system down, so you remain Th2 dominant, and it's doing nothing to help your immune system kill the cancer. Well, of course, your oncologist is going to say, well, we understand that the chemotherapy is killing the cancer, but you need that immune system not just for the cancer. You need it to keep the circulating tumor cells from metastasizing. So we don't want metastasis for this, and just because we want to kill this growing cancer right now and set this person up for a huge metastasis 2 to 3 years later that now is chemotherapy resistant, so it can even be worse. So you really need to stimulate a Th1 response, even more so if you're gonna be dealing with chemotherapy. But we'll talk about that as we go. I hope you're getting something out of these things. I'm trying to keep them short. And always, if you have questions, feel free to call our office, and we can try to help you through these things. All right, you have a blessed day, and I'll see you at the next section.